Well, you've been asking questions. We're going to try to get you answers. Well, for the next half hour, we'll be speaking with two experts who've been working day and night to understand this pandemic. And they are Dr. Fikra Humphreys, an immunologist at the University of Massachusetts Medical School in the United States, and Alana Shaker, global health expert based in Colombo, in Sri Lanka. Well, hello there to both of you. Thanks so much for joining us on this special programme. Well, I've got the same question which I'd like to direct to both of you, and this is about some estimates that have just come out from the World Health Organization, where they say 2 to 3% of people, only 2 to 3% of people have been infected by COVID-19. So how do you read this? With lockdowns being eased, is this a worrying sign that populations won't be protected by herd immunity? Or could it be interpreted in some respects as a good sign that COVID-19 isn't as infectious as some might have first thought? I'd like to begin with you, Alana.
Now, just to start with, let me be clear that I'm not a doctor, so I can only speak so much about the infectious disease aspect. But to me, it's a sign that lockdown has been working and we've been slowing the spread of infections, and that it means that now is not the time to let up and start more free movement again.
Okay, and what about you? How do you read this, Fikra? Is this a good or a bad sign?
I think it's a good sign, but it also shows that we need much more widespread testing to give us definitive answers about how prevalent it is in the community at the moment. So 2 to 3% shows that the spread is being limited and that the lockdown is working. But what we really need now is really widespread, efficacious serological testing to be able to test for antibodies in the broad community. And then I think once that's in place, then we'll have a much better idea of how prevalent it actually is in the community already.
Yeah, absolutely. And testing is critical, and that's something we're going to be coming back to in this programme. But we have been flooded with questions on social media about this, and which really indicates how worried people are around the world. And the decision to ease lockdowns is ultimately one that is fraught with tension. The WHO has also warned that the worst is still to come. I'd like to bring in this question to you, Alana, and this is from Abdib El Nouri, and he contacted us on Facebook and asks, and he's one of many people who's asked this question, is a second wave of COVID-19 coming, in your opinion?
Yes. Not in the sense of a single gigantic global wave, but in the sense that every community, every region, every country that brought people in with travel restrictions and stay-at-home orders, as they loosen those orders, we will see an increase in infections. And we're likely to see sort of a series of small waves. As we control travel, we keep people in place, infections decrease, people start moving again, infections increase.
Okay, series of small waves. Fikra, how do you see this? Hannah Aranovich contacted us on Instagram. Now, she's worried about this second wave, particularly about how virulent it could be. She asks, is there any way to know that now?
So there's a lot of people working on this. There's a lot of fantastic molecular biologists and evolutionary biologists tracking this and tracking any changes that the virus undergoes. And there are a couple of different strains in the community at the moment, but there doesn't seem to be any difference so far detected in how virulent it is. And whether or not it becomes more virulent, we'll have to wait for the data to come in. But on the plus side, what we're seeing now is we're seeing the emergence of different therapeutics and vaccine designs that are in development that would take that into account.
Okay, well, I'm going to come back to you in just a few moments. We're now just going to head to the Cube and Shauna, because given how much uncertainty there is surrounding COVID-19, there's not been investigations that have been done into testing, hasn't there been, Shauna?
There certainly has, and Iceland has been hailed as one of the countries that has managed to significantly curb the spread of COVID-19. This is a graph that has been created by the Icelandic government showing the peak and moving downwards, and one of the key attributions for that has been the amount of testing that has been done. With a population of just over 350,000, even on April 17th, they managed to test around 1.5 100,000 people. And this all goes back to a mantra of test, 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 something that the World Health Organization itself has been pushing for. This coming from the chief of the World Health Organization, saying here that so-called lockdowns can take the heat out of a country's epidemic, but they cannot end it alone. He says the next step is going to be to detect, test, isolate and care for every case and to trace every single contact. But what kind of testing is there available out there? Well, we spoke to an immunologist to break this down. Now, the first kind of testing is one that you've probably seen before, and that is the swab testing. Now, that is something that it means that it pushes the swab right back to the back of your neck or to the top of your nose. And what that does is that it tests for an RNA sequence. It is extremely sensitive, but timing is key here. It can't retrospectively test once you have fully recovered. And lastly, this is going to be crucial when it comes to contact tracing. But the next kind of testing is something that we've heard significant debate about, particularly in the last couple of days, and that one is the antibody test. This comes from your blood. It takes a couple of drops from your blood, and it tests whether you have antibodies. Some people think that this may bring immunity. Again, that's a key question. This is very fast. It takes only a couple of minutes. It's less time sensitive. Some people can have antibodies for a significant amount of time. Again, that's an unknown as to how long you will have those antibodies for. But there has been mixed reviews about this. There was a word of caution by the World Health Organization just over the weekend, saying that they have warned that there is no evidence that these tests can show whether there's immunity. But let's just throw into another question here as to what exactly we're testing for, because there's not just one antibody, there's actually a neutralising antibody, and that's going to neutralise the virus. And we don't know whether we have that or not. Let's just take a listen to what Professor Luke O'Neill told me previously.
We still don't know whether we have good neutralising antibodies to this virus. It's still a question. And that's a problem now. So even though you might have the antibody, it may not be neutralising, and that's no good to anybody, because that doesn't mean you're protected, nor does it mean that you're less likely to pass it on to someone else. So the neutralising thing is where this will move on to. That's a more difficult test to do. It's a very complicated test. Now, having said that, other viruses, we know we make neutralising antibodies to them, and just testing for antibody tells you it's more than likely neutralising.
So tests are certainly something that I've had many questions about, and there's been numerous questions on social media about the tests that are available and what they can do. Fiacre, I'm just going to ask this question to you. This came from Instagram. It says, when the tests are widely available, will they have to be adapted to when the virus mutates?
It all depends on what the antigen the antibody that's raised against the specific antigen. So what are you testing against? So what you're seeing now is you're seeing a few different antigens. We're raising antibodies against a few different antigens, and serological tests against the specific antibody are being developed. So you could be in a situation where you have a specific antigen from each virus that we're able to detect with one test. So until we know fully if there are big changes in these antigens that the virus present to our immune systems, then we'll be in a better position to be able to answer that question. But I think the best possible strategy is to develop antibody tests against an antigen that's common across any different viral strain for COVID-19.
OK, but it's interesting, isn't it? It's Isabel back again here, because testing is still being developed, but yet some of us are sending our kids back to school in Europe, others going back to work. Many of us hope to see our friends in the flesh again really very soon too. So there are a number of questions about that. And Fiacre, I'd like to bring this question to you. And this is from someone called Inahu on Instagram, who asks, when our society opens up again, what industries should be opening up first?
Well, I think you can see what the essential services are at the moment. So we have our healthcare service, we have our food services and delivery services. So I think expanding a little bit on that will be a good start, slowly, in phases over time. And then, if we do it slowly and gradually, we'll be able to see any spikes in detection of more cases. And then as we get through each phase, we'll be able to determine if it's safe to go further again.
And Alana, what's your take? Now, I'd like to bring in this question. This is from Damien Novinch on Facebook, and who asks, and he's questioning preventative measures here, and asking what measures need to be put into place in the work. Asking when he's required to go to the workplace, what should he be doing, and what should he be worried about when he goes back to the workplace?
The biggest thing that you can do to protect yourself on an individual level is social distancing. If you can avoid going to crowded meetings, if you can keep that 6-foot space between yourself and your colleagues, and then if you can wash your hands frequently, if you can sanitize frequently touched surfaces. People talk a lot about different kinds of sanitizing wipes. If you can keep wiping down doorknobs, phone handsets, anything that a lot of people are touching. So the key is to remember that it goes from person to person. So think about people and what they come into contact with.
OK, Fikra, I'd like to ask you the same question. So just as we go back into the workplace, what measures should we be taking? Do you agree with Alana there that really social distancing is the most important thing? Are there other things we should be keeping in mind here?
Absolutely, I agree with Alana 100%. Rigorous hand washing, cleaning down surfaces, and then trying to maintain social distancing as much as possible. And I'm also a strong believer in that, wearing masks can also reduce the spread significantly, and it can especially protect people from the asymptomatic spreaders.
OK, well, you two, I'm just going to throw over to Shauna here, because we've been getting a lot of questions from you live during this programme. Shauna, what are we being asked?
Absolutely. Here you can watch it live on Twitter, on Facebook and on YouTube. But one of the key questions we have had numerous times is whether a second wave is going to be coming. Fiacre, I'm going to ask you that.
Yeah, I guess it all depends on how long these lockdowns last and how much it comes back. There's a chance that it will come up again in the autumn, but I guess what's the great thing about it now is that we know so much more about this virus, and we know how to mitigate, we know how to test and contact trace and isolate, and also what's starting to emerge now and what you'll see happening over the next month or so is that you'll see results from a lot of big trials who have studied kind of different therapeutics that are able to manage the disease. So what we'll have great safety data, we'll have great efficacy, and we'll know if there are any candidate drugs that can actually block this virus. So then going forward, if there's any kind of rise in cases or another spike in the people infected with this, you're going to have much better understanding, and you'll have therapeutic strategies to be able to control it, which will take a lot of pressure off society and a lot of pressure off the healthcare system.
OK, but these developments are going to take some time to actually become widespread. But in the meantime, summer's coming. We're thinking about our holidays. France is now looking to stop flights in and out of the Schengen zone. Some airlines have said they're going to test passengers before they kind of jump on those flights. Others are looking at social distancing measures. So a lot of people we've been hearing from are worried about their summer holidays. So I'd like to bring in this question, because this might ease people's concerns. Do you think, and Mig Fidesz asked us, is there any strong evidence that the coronavirus will be less harmful in the summer? But then we got Anna Marku, who kind of joined in on Instagram, who said, but then if you look to Australia, they've also got cases of coronavirus. They're just coming out of summer. So does hot weather hamper this? I'd like to bring this question to you, Alana. What do you think?
A lot of people have expressed a lot of hope around this idea that this will be a seasonal virus and summer will bring it to an end. And if you look at past viruses like SARS, summer did seem to help bring a virus to the end. So that's the one side. The other side is we haven't seen any evidence or data that COVID-19 will be affected this way. And we had an outbreak in Singapore, which is plenty warm all year round because it's tropical. We've seen plenty of outbreaks in other places that are already warm. So I think that pinning your hopes on summer is a little bit of a pipe dream.
Pinning your hopes on summer, a pipe dream. What's your take on that, Fiacre?
Yeah, I'm inclined to agree. So what we know so far, it's a much more transmissible virus than other respiratory viruses like flu, SARS, or MERS. So it's also, there's been a lot of studies showing that this virus can survive on surfaces a lot longer. So it's probably less susceptible to things like heat. But as we go through the summer, we've never seen this virus before. We've never seen the kinetics of this virus, of how it goes up or down seasonally. So I guess what I would say is we have to get through our first summer periods to be 100% confident about how this drops off during the warmer weather. But I think going forward during the summer, I think the short-term pain for long-term gain is worth it. So if we forgo our summer holidays this year, there'll be many more summers to come where we're safe and free from this virus pandemic.
Many more summers to come. Just briefly, I'd like to pick up on something you said, that this virus does exist on surfaces for a certain amount of time. Just break that down for us, Fikra, please.
Yeah, so there's been some studies coming out when this virus emerged, studying how long this virus can last on some different surfaces, and it was detected to be able to survive for close to 2 weeks on depending on what surface it was. So that gives us an idea of how easy it is to spread this virus around. But what I will say is that the longer it is on a specific surface, the less infectious it becomes. These viruses are sensitive to different changes in the environment, and humidity and temperature. But it does seem to last longer on surfaces than other viruses that we've encountered before.
And staying with this issue just briefly now of summer holidays, Alana, George Papsusaki contacted us on Facebook to ask when and how should travel restrictions in the EU be lifted? Now, from what Fikra is saying, we should forget about summer holidays this year. Do you agree?
I mean, I know I canceled my own. I think that in order to feel comfortable traveling again, there will need to be a few things in place. One of which is simply that if the virus is at the same level of infection in pretty much every location, then we may as well travel because there's no shift. We're not taking it anywhere. So one thing to think about is as the infection spreads and it averages out, then travel can resume. Another thing is to think about, as we learn more about how it spreads and about infectiousness, what do we know about preventing that infection? And what kind of measures can we put in place around travel in airports, in airplanes, or railway stations to reduce the spread of the virus?
OK, Fikra, just on that, what would be the best way? So you're going to hop on a plane, maybe not now, but in a few months' time. What should you be doing?
Well, in a few months' time, we're probably going to be in a much better position, and we'll understand the virus much more. We'll have much more widespread testing and possibly, widespread serological testing. So, you'll be able to establish if you've had the virus unknowingly, and you'll also be able to establish how good our immunity is against the virus, and if we're protected against the virus. So I think that will inform a lot of decisions in the future about how air travel can resume and how, normality can resume.
OK, so life on pause for the moment, but questions flooding in are not on pause. Shauna is still monitoring those. Shauna, what are you seeing?
Well, we're taking your questions live from Twitter, Facebook and other social media platforms. So do send in your question if you've something to ask our experts. But this is just one particular question that I'm going to ask, and it's about immunity from COVID-19. This particular social media user, Pedro, says, how can we expect immunity from COVID-19 if we're not even immune from the common flu? So I'm going to ask that to Alana here. How can we expect it eventually?
You're asking the wrong person. You should ask Fikra.
Well, Fikra, I'll put that to you then. How can we expect it, the immunity from COVID-19, if we can't have it from the flu, for example?
Well, the thing about flu is it's been around for a long time. We understand it greatly, but what flu does is it emerges as a different kind of strain in every season. So what we see happening is we see everybody gets your flu vaccine every year, your flu shot every year. So the vaccine is designed and then manufacturing is ramped up against the flu strain that emerges every season. So because it's been around for a long time, we know broadly how to treat it and how to vaccinate against it. And also now there's a lot of efforts in flu research and to design a universal vaccine that will be able to give immunity against the flu in the future. So I guess if we apply the same principles to COVID-19, this is the first season of it, so we don't know 100% if it's changing or if there's going to be a different strain emerging every season. So, but when we do, that will be taken into account for any kind of vaccine design.
Can I just add a little question to you, Fikra, there? So if this virus does mutate, does the vaccine then have to be adapted each year to take that into account?
I think if it is mutating, some parts of it will be mutating and others won't be. So, what's known now is we are able to raise an antibody response and against the, different parts of the virus. So if there's a part of the virus that's not changing, then a vaccine that is specifically designed against, to raise an antibody response with that antigen, then we'll be in a pretty good position. We won't have to worry about something like that.
Alana, you've monitored many a global health pandemic, Ebola included. How fast have you seen kind of health providers adapt these type of vaccines if necessary? And when we see something as massive as COVID-19, do you think there'll be sufficient response and impetus to get these vaccines adapted in time?
I mean, the two things that affect the speed with which a vaccine comes to market and gets used is, first of all, the actual hurdles in terms of the research time in developing a vaccine. And you can't really rush that because there's certain timelines that are in place to see if the immune response is developing. You can't get around that. But the second half is the market incentives. Like, do manufacturers feel like the market is there? Are they going to be able to sell the vaccine once they're making it? And I think the market incentives are certainly there for COVID-19.
OK, so the market incentives are there. Now, we're just kind of going to close this programme now, and I really would like to get from both of you some really key points that our viewers can take with them, because when we look at vaccines, well, we're there a few months down the line. Treatments, we don't have them yet. So we've talked about safety, but what about adapting our behaviour? And how long, in your opinion, will we have to adapt our behaviour in the weeks, months, possibly years to come? Fikra, I'd like to begin with you.
Yeah, it's difficult to predict how long our behaviour will have to change for. I think that in the short term, what we can do is we can listen to the WHO, we can listen to the CDC, we can listen to, the epidemiologists and our healthcare specialists who are giving us the advice on how to proceed. So mitigation, social distancing, widespread testing, contact tracing. If we continue to do that and expand it to a huge capacity, then the pain will be shorter.
OK, the pain will be shorter. Alana, what's your takeaways from this? We've been overwhelmed by this pandemic in the world, but as you've observed it, as you bring in your experience, what should we be keeping in our minds as we look at the weeks and months to come?
This is going to be a long-haul process. This is not something that's going to be resolved and back to normal in weeks or even months. We have to be thinking in a long time frame, and we have to be thinking that there are things that may never go back to what we think of as normal. There may be changes that are permanent because COVID-19 isn't going to be the last infectious disease that we see.
OK, well, I'd like to thank you both so much for having joined us on this programme. It's been incredibly informative, and that is, of course, Dr. Fikra Humphreys, an immunologist at the University of Massachusetts, and Alana Sheikh, global health expert based in Colombo, in Sri Lanka. And thank you so much for joining us. And if you didn't get your question in, don't worry, there's still time to take part, because we'll be here again next Friday at the same time. And you can visit our website or follow us on social media for more information and the latest updates on COVID-19. Thanks again for joining us on this special edition of Euronews Now.
Hello and welcome back to Euronews Now. You're with me, Rosie Wright. Let's get you up to date with the day's top stories. Slowly leaving lockdown, European countries edge towards reopening as the World Health Organization